All right, Dr. G, thank you so much. Oh, goodness. All right, did you hear that?
I did. This meeting is being recorded.
All right. Well, Dr. G, thank you so much for agreeing to record with me and talk to me about what you do and all the wonderful things that you're up to. And I know you're a busy lady. So because I don't think I can do justice to everything that you are, embody, and do, why don't you go ahead and tell me and everybody else who you are and all the amazing things you're up to?
Oh, it's so sweet of you. Well, thank you for doing this with me and for doing this with all the people you're doing it with. I really, really admire people like you who are dedicating your life to practicing what you've learned and finding other people who have things to contribute. So really cool. So gosh, explaining me, I never have fun with this either, but I can start. I suppose I can start with sort of the official titles and labels, and the biggest one being I'm a Doctor of Science in Oriental Medicine. So I went to medical school and did medical clinical residencies at the National University of Natural Medicine. It's a naturopathic and a Chinese medicine school. And I did my doctoral degree focusing on classical Chinese medicine, which, you know, we can maybe talk about, but long story short, most of the Asian medicine that came to the West and is taught and practiced is often lumped under the word traditional Chinese medicine, TCM. And my school was unique, and there's not many that are teaching the whole system of classical Asian medicines that spans back more than 5,000 years. So that was a fun and unique opportunity to study beyond what kind of got synthesized and simplified and brought to the West. Amazing systems.
Right. Well, let me break in there just a little bit before we go into all the other things that you are and do. Did you practice that here or did you practice that elsewhere?
So I have been studying classical medical and philosophical systems that came from Asia for over 20 years. Yoga was my introduction to that world. And when I say yoga, I sort of mean what most people think of in this country and in the West as yoga. I was going to classes at yoga studios that are, you know, an hour or so long, and we did postures, a little meditation or chanting, and that was a doorway for me into, although I still love that type of yoga, what I would call classical yoga, which are the deep, rich, multi-thousand-year-old practices and texts that expand far beyond what most of us get to experience in what we call yoga classes. And in my studies, I ended up with a yoga guru and studying in an ashram and living out west and mostly in California and Oregon. And I had experienced acupuncture and Chinese medicine, but again, the kind that we call traditional Chinese medicine, which is mostly popular in this country. But it was through my yoga guru and this classical yoga that I was inspired to look at medicine differently. And he encouraged me to study Asian medicines classically. So these bigger systems, these older, rich systems. And that's how I ended up going to a medical school that had a special program for classical, what they call classical Chinese medicine. And so most of my studies and practices in that regard have been in California and Oregon. Many of my teachers are from or spent decades living in India, Tibet, China, Japan, and places in Asia where they had access to multi-lineage teachers that spanned back thousands of years. One of my teachers has 88 generations of practitioners in his family. So you can imagine the depth of that kind of learning. So I feel like a baby in this system, even though I got a doctoral degree. When I was graduating and getting this fancy title, I felt like I was maybe in second grade.
Yeah, right,
you know?
right.
And during those times, my heart called me home to West Virginia. I really and so I spend time in West Virginia, because of a different type of roots, my own personal biological roots there. And because as I learned these medicines, which are still the alternative medicines, even in California and Oregon, they're even more alternative in West Virginia, almost not present. And when I say that, I will say, since coming back to West Virginia, I am blown away by, although it's only a few, by some amazing people who have taken root in Appalachia and are practicing ancient Tibetan and Ayurvedic and Chinese and other Asian medicine. So there's not a lot of us in Appalachia, but the people that are there are just exquisite and have also had to travel and leave often to find our teachers and develop our practices. And there's a beautiful community that is, kind of, we're finding each other in West Virginia and in those areas now and practicing. But I also still spend time out west with my teachers and fellow practitioners to continue my studies.
Right. And I find that kind of what drew me to wanting to really speak about these modalities is because, they were some of the modalities that helped me the most, but they weren't well talked about here. And I'm not originally from West Virginia, but I've lived here long enough to where this is home for me. Mm-hmm. And they were really hard to find. And it wasn't something that people were openly talking about. And I want to kind of go backwards and touch on something you said about, these practices being around for thousands of years, yet we call them alternative. Can mm-hmm. you speak to that just a little bit? Where did it start to shift to these modalities being, quote, less than what we would call traditional medicine today? And how can we kind of mesh the two together and also give respect where respect is due?
Sure. Well, I am a big fan of integrating all forms of medicine. All right. Forms.
I completely agree.
I love the thought of practicing integratively and acknowledging where I have depth and specialty. Now, certainly allopathic medicine, or if you call it biomedicine or Western medicine or modern medicine, whatever you want to lump, anything other than what's now getting lumped into alternative medicine.
Right.
so even within that category, there's so many fields and rich histories, of how different parts of Western modern medicine evolved. However, in general, that system, although it's much younger and newer and was designed and created with a different type of mindset, it's actually a very allopathic mindset, which means we look at the disease and focus on treating the disease. That's really all allopathic medicine means. And in the Western mind, in the way the mind that developed, the type of cultures that developed those type of medicines looks at disease is very different. And at times, the most beneficial way to look at healthcare. However, that system, just like everything else, I don't care if we're talking about architecture or economics or education, the Western models, the way the mind looks at healthcare, education, social economics, it thinks a different way than the minds that created these, whether you call it alternative or Eastern or classical or traditional or indigenous medicine systems think. Really, at the end of the day, the modern one won out because it is the predominant economic force that drives this country and the West, and now really in most cases the world. That system became the most popular system. It's the newest, but it's the biggest, strongest, toughest kid on the block.
Right, and that's really kind of hard. That's kind of a tough beast to face a little bit.
Yeah,
when there's money involved.
you know, I've gone through a lot of emotional phases and ways that I look at that in my lifetime, as have done with a lot of things. But I was very angry at Western modern medicine because I grew up with a lot of health issues that it not only did it not solve, but then I felt like it created more problems for me instead of solving the ones I already had. And I was frustrated and angry with the doctors who just wanted to put me on pills or tell me to put metal in my back and that I'd end up in a wheelchair. And I was just like, this system's really failing me and failing the world. And I was angry. And, you know, there's maybe something good came out of that, because the stubborn person that I am, I don't believe this. For whatever reason, I didn't buy into that. Now, and so that forced me to leave West Virginia and to seek other things. And I, you know, learned all the things I did. But really, I have come full circle, because in my journeys, as both healing myself and becoming a practitioner, I learned the most cool, amazing, beautiful things about the modern medicine systems. And I learned how to be an advocate and really do something that a lot of alternative systems do well, which is individualized medicine, to look at each individual differently. And there are great, great MDs and nurses and other Western medical practitioners out there that have also come to this conclusion. But by and large, that system is still really economically driven. And because our Western ways of thinking of the world are very materialistic, we think of the body as we think purely physically. It's a body. You touch it. It's got bones that break. I fix the bone. Even the way we approach psychology has still got a pretty reductionist way of looking at it. For example, the fact that we have a field that's psychology, that we separate the mind and body, that alone shows us how we have a very simplistic way of looking at medicine. And it's, you know, the old ways are more complicated. The alternative ways, they're not as easy to measure and test and standardize. And so they are, in a sense, impractical.
So,
and the modern.
So would you say that, you know, the traditional or Eastern medicine ways are more mind, body, looking at the individual as a whole? That's what separates the two. And then also not being able to measure the results of a treatment per se.
Well, we don't. So modern medicine has a pretty reductionistic view of how we treat. We try and take a list of symptoms, and if we find that list of symptoms in 10 different people, we give it a name, and we give it one treatment. And that is the practical approach to how to treat something. That's a reductionist way of doing it. And we also like to more think of the body, you know, in the modern mind, it's like a machine. If a part breaks, you fix the part. So the holistic, as the word that you used, I like that word better than alternative, although I'm not offended anymore at alternative, because anything that isn't in that mainstream is an alternative. So fine, I'm definitely not the mainstream. Call it whatever you want. I'm not alternative. But the thing that we do something that's called differential diagnosis in classical systems, which is treating each individual. Even if 10 people come to me and present almost the same exact symptoms, I may treat each one of them very differently for a number of reasons. And that is, it's called holistic medicine, individualized medicine, but it's not reductionistic in nature. It's individualistic in nature. And so that's a big difference. And then we can look at how we do that and why we do that. And then that goes into what you're talking about, because our system, we don't just look at the physical. We look at the, if you want to call it psychological, mental, emotional, and we look at things that, this is a loaded word for a lot of people, but we say spiritual. Really what it is there's the things that our mind are doing and our emotions that we can kind of observe and see, and the physical that obviously we can touch and measure. And then there's this other stuff going on in all of us all the time that all of us can acknowledge is there, and we can't see it, and we can't cut it up and measure it. And yet we know, for example, just the word stress alone the word stress,
Yeah.
how do you measure stress? Where does it live? Where do I cut it out of me? Or even even to look at brain scans, that won't capture all of what the concept of stress is, nor will we be able to do that with the concept of love. What is, that we know we believe in love. Love is real. Go ahead and measure it.
Right. And I think that's what
Fear.
scares people probably the most about these modalities. Because I will say in my own healing journey, it was not until I started dealing with those intangibles, the things that you couldn't see or measure, where my health really started to turn around. Yes, I did all these other physical things that I could measure, but it was in the intentions, in my lifestyle, in my emotions, how I was dealing with all these other things that kind of really changed and really turned it around. So I think that part of it can sometimes scare people a little bit. Like, ooh, I got to deal with that stuff that, can't you just give me a pill or, what have you to kind of make it all better. But it's really,
and sometimes we can. Sometimes it can be that simple. I love it when it's that simple.
Yeah, sure.
Not that simple.
I mean, we all do. And I did I had this question that came up earlier while I was listening to you talk. Do you think that along the way, somehow we have forgotten how to listen to our own bodies, our own minds, and really in doing that and really not knowing ourselves and knowing how our body operates and knowing how our mind operates and what our wants and our needs and our et cetera are, that we have forgotten how to take care of ourselves, and we put so much weight on then going and seeing a physician to say, fix me after the fact? Like how important is it to really understand ourselves in preventing these things from happening, these illnesses, these labels, or what have you?
It's a beautiful question, and I would simply say that the basis of health for all of us is getting connected to the laws that relate to all natural phenomena within and around us.
Mm-hmm.
And the thought that is the basis of health and is the foundation, that if you want to separate us all as patients and doctors, but both, that whether you're the one needing help or offering help, to come to that foundation first and see how an individual is in or out of balance within themselves and with their environment.
Mm-hmm.
Is where, if we don't start there, we will always miss something. That's the foundation. So a lot of times, even alternative medicine practitioners forget that.
Yeah.
So, and certainly those of us who are patients, who are coming seeking help, not only forget that, we were never taught that. And it takes practice. There is not a pill that does that gets us connected. And so those practices, the philosophies, the concepts, and the practices that allow us to relate to all natural phenomena in ourselves and around us, is something that is getting found again. Let's put it that way. We are rediscovering this, and all sorts of healthcare practitioners are remembering this on the planet right now. And for many reasons. One is our environment around us is a bit of a mess right now.
Absolutely. And I think people in general are feeling disconnected, not only from each other, but from their environment. And if you think about how environment works in general, it works together. I mean, everything is connected. And if that, if there's these little cracks and these kind of cuts in the connections, there's going to be chaos until it can heal itself. And I think you're right. I think that's exactly where we are, feeling disconnected from ourselves and from other people and from the planet and the environment and et cetera and et cetera. And I know that sounds really woo-woo, but
wouldn't it be nice if that didn't sound woo-woo? Because
yeah,
it's
right.
not. It's really, I mean, one of my longtime students would always say, I like you because you're only part woo-woo. And I always thought that, at first I was like, I'm not woo-woo, what are you talking about? And then there's other people who are like, well, yeah, no, Dr. G, you're all woo-woo. So however people want to perceive it, it's fine. But what really is happening is that we're realizing these things that get labeled as esoteric or woo-woo, they, science has already proven that a lot of those things that we used to say that about, well, now they're not woo-woo, because science, the new science, modern science, has figured out how to measure some of these things that just 25 years ago we did not know existed on a material level or even had an aspect that could be measured. My doctoral thesis was on the endocannabinoid system, for example. Have you ever heard of the endocannabinoid system?
Yes, and actually that was on my list of questions for you today, because I really wanted you to speak to that.
And in general, we can just say, in 1990, we didn't know that system existed. 1990 isn't that long ago. And there's all sorts of things now that modern science and medicine are discovering, because they figured out the actual a component of our physical system. But my work was on thousands of years of how people who we didn't need to see that physical component. We knew this thing was there, and we knew different herbs and meditation practices that stimulated this system that then regulated all these other systems in our body. Well, it was just woo-woo, but now it's not, because now we know, meditation does have a cannabinoid effect on the body. They're now starting to be able to measure that.
Right, so it has a physiological effect.
Yeah, and we know not only, we've known that for a little while. Meditating can reduce heart rate, improve blood pressure, obviously improve stress management. But now what we know is actually the receptors in our body that are somehow getting stimulated when this happens. That's cool. We still don't understand it well. 20 years from now, 30 years from now, we'll understand it more. So it's understandable why we need to lump all these things that we can't yet measure, maybe we'll never be able to measure, into woo-woo and discredit them. However, I think most intelligent people now can realize we've already been able to prove things that 50 years ago they said were crazy.
Sure.
I mean, electricity.
That's why it really bothers me when somebody says that the science is settled on something, because I don't think science is settled on anything. We continue to learn and to grow. And when you become open-minded to these other ideas and then are open to then studying them and discovering these things, it's really fun to think that, this system thousands of years ago was, known, but not known. And now it's in science and can be measured. And I really, that gives me hope a little bit.
It does. And I love scientists, and the best among them, in my opinion, end up where you're talking about. I don't care how they could be a hard empirical research-based scientist. If they stick with whatever they're studying long enough, they are going to find things they just can't measure, but are there and are real. And even though they want to figure them out, they haven't figured them out. And most of those people have an aha moment that has a spiritual nature to it. It really does, because they go, I know it, I see it, I grab it for a second, but I can't hold on to it. I can't put it in a box, but it's there.
Yeah.
And, and so when we know enough things are like that, and scientists know that, then we can look at ourselves and our individual healing journeys and our health issues, that really every one of us has had some experience where our doctor just couldn't figure us out.
Yeah.
The test didn't work, the medicine didn't work, the surgery partially worked, but then caused another problem. You know, we all have these. There is no settled science. Come on, the best scientists still make mistakes. The best medical practitioners can't solve every mystery of every patient that comes into them. We're all working on this.
Absolutely. And, you know, that kind of brings me then to labels. And I'll say, you know, I was a mystery case for a while. And then I ended up getting a few different diagnoses, Hashimoto's, Graves' disease, and then adrenal fatigue. However, those things can be treated very differently in the, and again, I too do not like to use the word alternative medicine, but they will not be treated the same way, and the same things that I do may not work for somebody else with my same conditions. It wasn't until I kind of shed those labels and just started treating myself as a whole. There's some sort of imbalance that is causing all of these other imbalances that you may call Hashimoto's, Graves' disease, adrenal fatigue. Yeah. And how detrimental can those labels be for somebody? How much of a block can having that label or that diagnosis be for somebody who is trying to heal and heal themselves?
You know, I think they can be as beneficial or detrimental as both the doctor giving the diagnosis and label allows them to be, and the person receiving that label. They, you know, some of those labels help point us in the right directions.
Sure.
Others literally steer us in the wrong directions and take us off course. And a lot of modern medicines, as you're calling them, labels or diagnoses, are not definitive. And they're definitely not differential, meaning your diagnosis is going to be slightly different than the next person who gets Hashimoto's. It's not a differential diagnosis with differential treatments. Right. And that's what you're alluding to. But those diagnoses are really just putting a label on a list of symptoms. A lot of times, yeah. There's certainly disease labels that we take blood, we see the influence, you know, we see a virus or a bacteria that is proliferated in the system, and you have excess candida. You know, but however, if we just treat that excess candida and don't treat the whole system, that excess candida pattern might come right back because the thing that was causing it is still there.
Right.
So a lot of times, a lot of the labels, the symptoms, the labels that you were given are really still alluding to symptoms. Mm-hmm. And they're not alluding to the root underlying cause of those symptoms. And so if we don't allow those labels to help us find the root underlying cause, and we just allow those labels to get us stuck on, oh, I have all these symptoms. And when you have all these symptoms, we call it this. Yeah. And we try and treat that. Then we're just chasing dragons, we call it. We're chasing symptoms, and the roots aren't getting touched.
Right. And I feel like that's where, you know, you kind of mentioned in your own health journey where you said I don't accept this. I do not accept that I cannot get better. I do not accept that. And I think many of us get to that point. Okay, I have a diagnosis and that I'm relieved. But when I'm being told there's nothing we can do, take this pill for the rest of your life, many of us get to that point where that doesn't make sense to me. That does not make sense, that there's not something that I can work on or some things that I can work on to make myself better. And then you kind of just get into this like mode where you need to figure it out. And that's kind of where I've gotten and where, you know, other people have gotten too. And you discover so much about yourself along the way. You know, and it's funny too. I've never really understood my body as much as I understand it right now. And I don't think I ever would have had I not, gone through all the health issues that I went through. But it's kind of like an amazing, beautiful, frustrating process.
Yeah, the other day when I had a patient that left, I said, I feel like I'm more of a detective who just solved a mystery.
Yeah. No, it
Was fun. I
definitely
mean,
feels
she'd
like
been to
that.
4 doctors over 4 months, had hives all over her body, hadn't slept a night through in 4 months, been to her family physician, a dermatologist, an allergy specialist, and a functional medicine specialist, and nobody could figure it out. And long story short, I figured out it was her carpet cleaner.
No.
And she's been walking around barefoot in a house since the shutdown.
Yeah.
So she's been exposed to a toxic chemical at a level she previously hadn't been because she was cleaning her own carpets, and that was our session. I didn't do a lot of hands-on work. I was ready to start prescribing her herbs because I certainly have herbs that can clear heat and rashes. But really what it came down to is she needed to wear slippers in her house until we could get her carpets cleaned, and she's all better.
Until we could get the toxins out of there. Sure.
I mean, I don't know why, obviously maybe that example just came out, but that's solving the mystery, and that's looking beyond the symptoms. I was looking for the root.
Right, absolutely. What
and those other 4 doctors, they did allergy tests, they drew blood, they were looking at the symptoms.
Right.
Right. And how the allergy tests all came back negative. So they just decided, well, this can't be an allergic reaction.
Right.
But it was.
It was.
So I bet you if we listened to I know you've shared your healing journey with your listeners so they can hear that, and I can share mine, and the diagnoses I got were very fixed. They were labels that were definitely like, well, you don't get rid of this. This is just something you're going to have forever, and it's probably going to get worse over time. So let's just start treating that and do our best. There wasn't ever in any of the diagnoses I got as a child or a young adult, the thought that these things could be, if you use the word healed or fixed or those labels to go away. And sometimes that's true, of course. I'm not dismissing the fact that some of us definitely get things that are lifelong challenges, but none of us get handed something that there's nothing we can do about. And there are always options in addition to or other than the pharmaceuticals and surgeries. Those sometimes are the best options, not always. And no matter what, these things that we call alternative are always at least give them a chance to be complementary to the drugs and surgeries to help you reduce or eliminate some of those symptoms, or possibly, like we just said, get to the root and maybe even have a radical, unexpected, complete turnaround in a condition.
I'm really glad you said that, because it gives people hope where sometimes other avenues feel hopeless. And I think it's all about finding your team too, because there are so many different modalities and so many different practitioners that can help you help yourself, help you heal yourself.
We all have to be detectives ourselves. I mean, I was just talking about how I as a practitioner was a detective. Well, me as a patient, I love the word patient. We need to be patient.
Oh, absolutely.
Patients need to be patient, and we need to be patient with our practitioners. They're doing their best to solve us, but we also then have to be patient with ourselves and really get committed to our health. And if we resign to the label and the diagnosis and just sit back and expect a person to take care of us and don't really take some initiative to be our own advocate, and so I call the people that come to see me, I don't know if you've seen this in my materials, I call people patient students.
Yes. And I love that.
And the people that come to see me know you're going to learn and you're going to have homework.
Right.
This is not a one-sided thing where you just come in and I fix you ever.
Mm-hmm.
And even when I do, because some things I can, right? Someone comes into me and their wrist has been sore and I just go, joot, 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 and now the wrist isn't sore and I fixed it. Yay. I do that all the time, actually. But I will never send someone away without information to help them either not have that injury again, or to improve the strength and flexibility of that area, or to look at how that thing that they came to me with was connected to 4 other things that they didn't even mention to me. And then they're like, wow, really? My wrist can affect my digestion? What? And so to be willing to learn is an integral part of really being able to heal.
Right. And I think, I think that we forget that. We forget that we can take our health into our own hands.
Yeah.
And that journey of trying to be a part of the healing process can be really rewarding. You learn so much about yourself, and I mean, I think that's been probably the most rewarding part of my own healing process, is that you just really start to understand yourself. And any good practitioner too that I've ever been to will say, I would like to get to a point where I don't have to see you anymore. I would love for you to just understand yourself well enough to know how to get these things under control, and that you don't have to see me. And it's just like, oh my God, that's so empowering. That feels so great. You don't feel used. You feel like you're in kind of a partnership where they're really rooting you on, and they're there when you need them, if you can't get things under control. And I also like to remind my clients though too, you mentioned patience, that you didn't get here overnight. You're not going to feel better overnight. There's no just magic, pill or magic treatment that's going to happen. I'm going to do it once and you're going to feel better. It does require patience, and it does require hard work on your part.
And no matter how amazing someone helps us get to a state of wellness and health and vitality, that we don't just get to stop there and stay healthy and well and vital. There's always going to be work to do. And, another thing, and certainly right now in the world, I think something that's coming up with having this pandemic, in so many of our minds, if not in our physical bodies, is a true fear or wish of avoiding sickness and actually even death, which, you know what, sickness and death are omnipresent. Sickness and death are a part of life. None of us are going to get from birth to death without some sickness, some health challenges, and none of us are going to get to death without dying. It's going to happen. We don't get to avoid them. What we do is do our best to minimize the symptoms and negative side effects of the health challenges that every one of us are going to experience, and navigate them in a way that helps us become more vital and prepared for whatever the next challenge is that's going to come in our lives. And that's the difference between, to me, that's why I consider myself a healer and a teacher, because I might be able to heal or fix you in this sickness right now, and you may need me less as that. The teacher in me wants to remind people that we all need to keep studying, we all need to keep practicing and preparing for whether it's the next sickness in ourselves, the ability to help other people, and eventually the fact that somewhere along the way, all of us are going to reach the end of our lives. And how we do that, we can go into that part of life with fear and resistance and trying to avoid it, or we can embrace our realities when we do face sickness and death with love and compassion and grace, and live and even be sick vitally.
Right.
We can die vitally. This is a scary concept. People are like, I don't want to talk about dying. Well, you know what? Good luck with that. Could you introduce me to a person who doesn't have to deal with death?
No, correct. And I'm really, really glad that you said that. And I think it's a really important point. And it's a conversation my husband and I have actually had throughout this pandemic. It makes me a little frustrated and sometimes angry, in fact, that we're not talking more about what we can do to be in the best shape possible for if we do get sick. what
This
can
is
I
the
do?
most,
What can I do now that in case this does come into my household or into my body or into anybody I know, what can we be doing to be in the best shape possible? How can we be as healthy and as vital as possible? And we don't talk about it enough. And it quite frankly, yeah, it infuriates me sometimes. I mean, I have to I have to
it's the
remember,
most
not
important, I
everybody
think.
thinks like this, but yeah, you're right. And I think that is a really, really, really vital, beautiful point. The living vitally and also accepting that none of us are getting out of this alive, period.
And I think I wrote a piece and I did a few talks that are somewhere online now, but about community and immunity.
Yeah.
So, the immune system and developing strong, healthy immune systems, acknowledging where all of us are compromised with our immune systems, and figuring out how to create environments that support healthy immunity, which requires a community experience. So we can look both within our home, we can look at our grocery stores, what our restaurants serve, there's so many
Our schools.
ways.
That one's a big one for me. I'm with 3 kids, but
and that viruses and bacteria have been around longer than we have as a species. Viruses and bacteria are omnipresent. They're not all bad. Even the bad ones that can kill us have roles on this planet. We are growing, changing species, interacting with other species who are growing and changing. A lot of our viruses come from that animal-human dynamic. And that's always been the case. It always will be. Some of these things will be man-made, others animal-made, others plant-made. And this is again, yeah, we've always coexisted. We've all been a part of why we kill a lot of animals. We give a lot of animals diseases, and vice versa. But ignoring the laws of nature and ignoring the laws of nature, whether it's sickness is a part of life, death is a part of life, viruses and bacteria are a part of life, and learning how to live in balance as much as possible with sickness, death, viruses, bacterias, broken bones, all the things that can happen. Just learning and ignoring the laws of nature is what gets us into crises. Right? Honoring the laws of nature will never allow us to never get sick again and live forever. But if we honor the laws of nature and look at these things and stop being so resistant to them and afraid of them, and really look at how do I develop the healthiest relationship possible, we can't hide from every virus forever. We just can't. We have to be careful. We have to do things that will allow us, our immune systems, to be able to navigate this world. And so we can hopefully one day again, and some of us sooner than later, depending on our age and our health. And if we live in New York City or in West Virginia, there's a million variables, but interact and get back into the game. And then the next thing will happen. This pandemic will be over, whatever that looks like. Nobody knows how that looks, but then it will calm down and it will eventually be resolved, and then a new challenge will arise.
Absolutely. And how much of this can we attribute to lack of education, as far as so many of us not being taught how to respect that we are a part of something much bigger and that we all coexist together? Because I never thought about it. It wasn't, you mentioned earlier about, these healing techniques being passed down for thousands of years and amongst all these generations. That is not something we do in our country and within our families. How much of that is just kind of us not really respecting or educating ourselves or being educated about this bigger picture, like zooming out and this bigger picture?
I think all of it is about that. And that's the trick, though, is where do we find that teaching and the practices that allow us as individuals, much less as communities, towns, states, national, global communities to reintroduce and reintegrate practices and teachings that help us get there, to help us get to that level of awareness. And education and healthcare are everything. Focusing, on education, healthcare, and the environment. And to me, those are the top three things. If we
Absolutely.
could do that, and there's not one way, because if you live in Norway, you need different things than if you live in Tahiti. But for sure, there are, and I think modern medicines are beginning to realize that we need to figure out a better way to get more people educated. Educating people in indigenous communities that have a lack of resources or access to clean water. We've learned that if we go in there and educate people on basic hygiene, teaching them to use, people don't even know that they need to wash their hands, and just keeping the hands clean can reduce the disease in a community like that by 50%. That's just education. It's very simple. Healthcare for women, really simple reproductive teachings for young adolescent girls in developing places where they don't get that basic level of education can reduce pregnancies and fetal mortality and all those things. A little education, a weekend class for a bunch of 12-year-old girls.
Way, right.
And so then there's our world, there's our developed world, us in West Virginia. The access to really clean, non-processed foods and the idea, there's still so much resistance to the radical concept that we would be healthier if we ate whole foods that don't have a lot of chemicals sprayed on them, versus just that. But how hard is it to educate a population on that, what seems to you and I maybe to be logical? That's not woo-woo. That's, if you eat whole foods that don't have chemicals sprayed on them, your body will be healthier. Sounds so simple, but when you have a fast food restaurant, literally, in Morgantown, how many restaurants that are literally, most of what they serve is processed, And so when our governments and our communities and our economic systems not only allow but promote and support things that really, I can't have the debate anymore, and I try to stay compassionate, but you can't, there isn't even a debate. The processed foods will not create a healthy system like a whole food will. But so that education is hard to get out there when we're up against, but there's cheap processed food available and I need to feed my family.
Right.
So I'm getting here to say that yes, the education is important. Yes, the awareness is, but if the system doesn't support that awareness and that information, even when you educate people, even when anyone you talk to would say an apple is going to be healthier for me than the French fries through the drive-through, those people know that, but they're still going to go through the drive-through and get the French fries instead of the apple.
Gosh,
So
it's like a vicious cycle too.
It's a vicious cycle, and the very beautiful truth is, if this time in the world is showing us anything, it's that I do think people are realizing we have to be healthier. We have to figure out how to be healthier. People who are getting more sick and having more problems, it's becoming harder and harder to deny that the people that are struggling more with whatever the current or last or next pandemic or problem, even the fires that are raging through the West right now, if you go into these kind of fire disasters with strong, healthy lungs, you're going to have a better chance at surviving the bad air quality than someone who doesn't have healthy lungs. So we are seeing that the people that are struggling the most are the people that are going into the crises, whatever the crisis is, with more compromised health. So you know, we may have to learn the hard way, but I think we are learning now because the ways are getting harder.
I hope so. Sometimes you have to be slapped in the face for a change to
Yeah.
kind of be ignited. And I
Yeah,
hope that's what's happening.
I mean, that's what happened with you, like you said, with your health
Oh my
issues,
gosh.
right?
Yeah, no,
Right.
I mean, I wouldn't have thought twice about what was happening inside of my body, or the amount of stress I was putting on myself, or any of those things. I would have continued on doing what I was doing, eating what I was eating, you know,
I would have eaten
bottling
sugar
up
all day, every day for the rest of my life.
Exactly.
I loved
And I see it as a bit of, in some way, a bit of a blessing, as crazy as that sounds, because I don't think I've ever felt as vital now, ever. You know, and I was diagnosed again,
it.
at 33 years old. And I remember thinking to myself, I can't feel like this the rest of my life. I'm 33 years old. At that time I had two little kids, and there was just no way. There was no option for me to feel like that.
Right.
But, and I know, so we're running a little short on time here. I know you're really busy. I would love for you to tell kind of a success story, like either a patient student of yours, or even your own story, something just that gives somebody hope, or any of my listeners hope, that for healing or just a transformation in their life. If you have just one good transformational story, I would love to hear it.
Oh my gosh. You know, when I've been asked this, and I think different times I come up with different stories. Certainly my own is a fun one, and the fact that I've literally helped, you know, people who had 11 miscarriages, their 12th one come full term, and I know that baby, you know, or, you know, deaths. I could tell you stories about helping people die, and it sounds crazy, but sometimes that's the most where I felt like I was the best healer, physician, doctor, is when I was able to help someone cross over in a beautiful way, where they were surrendered and graceful, and their loved ones surrounding them, to see that become a beautiful experience. And of course there's always a tragic component, where the person dying and the loved ones near them were grateful, and they were at peace, and there was a release of tension instead of a building of tension in those last days or weeks. That is, you know, births and deaths, I guess, come to me as an example, because those are the miracles. I mean, that's the miracles of life, or the biggest thing, right? We're born and die. Can we do those things in a really healthy way? My healing story is pretty relevant, especially to your group of people that maybe, I know you get people listening all over the world, and certainly you're based in West Virginia. And because I was born and raised in West Virginia, and a lot of my pathologies were really diet and lifestyle induced. I grew up in a good, you know, my parents loved us. I had great friends, and we kind of lived all the same way, but for whatever reasons, by the time I was 12 years old, I was diagnosed with progressive scoliosis, rheumatoid arthritis, and manic depression. I think those were the three biggies. And that's from the mental to the physical.
That is across the board. Yeah.
It was across the board. And that's a lot of stuff. That's a lot. And I cried myself to sleep and awake in pain, both physically and psychologically, every day. And still, you know, went to school, and most of my teachers and my friends had no idea I had diseases that no one could see. Right? I mean, my spine was curving progressively, meaning getting worse and worse, but I was still tall enough and athletic enough, and, you know, people didn't know that was happening in me. And rheumatoid arthritis is a hidden disease that is debilitating, and anybody out there who has any type of arthritis can understand how systemic it can be, and how painful. And then the diagnosis of manic depression was my emotions were all over the place. You know, I was a high achieving kid, and at the same time super sensitive, so could go from being elated and in a really good mood to just devastated and crying because someone said something mean to me or whatever, or for no reason. And, you know, all those kind of diagnoses were hard, and the solutions were also really drastic. It was, you're going to be on this medication forever, and we need to put metal in your spine, and you're probably going to end up in a wheelchair otherwise. And, you know, it was just really all sounded very terminal and
very scary.
It's very scary. Yeah. And so, you know, my story is too long of a story, but that's the other thing in a short way that I can share with you is the healing wasn't a quick overnight thing. The healing for me personally, in the end, whatever pills or surgeries were or were not a part of my journey, which for all of us is different. And I'm not ever, and I hope people understand, I'm never saying all drugs and surgeries are bad and wrong. It's absolutely not true. And I work, like I said, integratively, and there's a lot of times where those things help. But I can say my story ends with after a very long journey of learning and finding teachers as much as doctors to help me see these alternative perspectives of my body and my mind and my health, and then ways to eat and ways to live. I was an athlete. I had to change my athletic things. I had to slow down in some ways and anyways, I had a long path, but I did it pretty quickly, got to no drugs, no surgeries. I avoided having metal put in my spine. I'm very grateful still today for me being stubborn and avoiding that at the time where I was told that was unavoidable, and giving time to these alternative possibilities. Because I said, even though the doctors are telling me there is no other option, I went, well, if there really is no other option, then I'm going to live as long as I can without metal in my body and deal with the pain, because once you put it in there, it's never going away. And I'm really lucky that during those couple years, I met a chiropractor and a homeopath and some natural medical practitioners, and yoga came into my life, you know, when I was 19, and I'm almost 50 now. So it's been a long time, but I've been pain-free and metal-free and drug-free since I was in my early 20s. And I have
had a very vital life since then.
And I have, you know, no one now would diagnose me with any of those diseases. I have a mild curve in my spine, but it has reduced, and I stand more straight than most people. And the arthritis is 100% gone, unless and this is the thing, unless I really decided to be really stupid with my diet and lifestyle. And then I still have a predisposition to these things. So I can end up putting myself into a flare-up, but I'm so healthy now, I can even do some of those things that were bad for me or inflammatory and be fine. You know, that took a while. These things took a while, and I really had to stop resisting changing my diet and lifestyle and embracing things. And now I love it. And I look back and I wouldn't want to eat the way I ate for anything. Like, you could say, I'll give you $1 million a year if you eat like this, and I would rather to be poor and eat how I do. That's another funny fallacy, that it's too expensive to eat healthy. It's just not true. It's less expensive in the long term to make these changes, and you won't want to go back once you get to the other side. And I didn't realize that. So as a West Virginian, I feel like my story is a perfect example of someone that was like,
you can do it.
I don't want to eat that food. Gross. You know, like the healthy foods for well over a decade, the thought of eating the way I eat now would have been disgusting to me. And now it's the opposite. And I can come back to Morgantown, and I'm very grateful that the Mountain People's Co-op still exists, and that there's community supported agriculture systems, and that there's a handful of restaurants, Hill and Hollow, and these other restaurants that are doing local whole foods. And you know, we've come a long way.
Would be shocked to find here, knowing the stereotypes of this area. It is really surprising that it's kind of a little haven.
And I really give credit I always I give credit to myself. I had the wherewithal, the patience, the bravery. Any of my patient students that make these kind of radical changes from debilitating diseases and labels and drugs and surgeries are their only options to vital health. It takes most of us, it takes years, and none of us get there alone. None of us get there alone. I could not have done this if it wasn't, I could name every single doctor and teacher along my path, and I'll cry right now if I start, because they saved my life. They changed my life and saved my life, and I still am completely devoted to because they're devoted to me. I'm finding a handful of practitioners and teachers who are happy, like you said, to help me and me get to where I don't need them, but then still stay connected. And I still continue to learn from them, and I still continue to get healthier and healthier, and I find more things I can work on. And certainly then the other beautiful thing that happens, which you are a beautiful example of, is once we start healing ourselves and learning these things, we cannot not share it with other people. It's what happens in our bodies. Every single person must do self-care. And then when we experience a level of success with that, the natural thing that happens is we want to care for others more. And that is the only, so back to your first question, which was what I do and what my training is and how did I choose this path. Like most of us, we started with self-care. We either through luck or perseverance or intelligence or whatever, managed to find teachers and doctors along the way to help us with our self-care. And then that naturally, inevitably, there's no part of me that could not have, my life changed so much that the only thing I could imagine doing with my life is possibly helping some other people get to have that kind of experience.
It almost feels like a responsibility more
It does.
as much as it is a need, it almost feels like a responsibility.
It changed. I owned television stations. I was getting into and I still love production work. I do very little of it now because of how much time I'm happily focusing on healing and education. But even in sorry, hang on a second. Even in the context of production work, those years as I was healing, my production work turned towards healthcare and education. It's impossible to not end up helping others once we've been helped. And so how beautiful is that, to think of this ripple effect that you and I are a little part of, and there's people that helped us get here, and now we're helping get people here. And that's where I have a completely optimistic hope for our world, even though we get frustrated with the labels of alternative or being dismissed or not acknowledged, or I spent as much time and money on my doctoral degree as a person with an MD degree. Right. I did as many hours at a medical school. I did as many hours in residential shifts at clinics and treating patients. And I can't tell you how often I am dismissed or told I'm not a real doctor. Especially when I get into,
that just blows me away.
And it's, yeah. but it is changing, and it changes one person at a time. I don't need to change the whole world. I can't change the whole world, but we are changing the whole world just by us doing our self-care and helping whoever is ready to come to us and work with us.
A little bit at a time. Absolutely.
And it is happening, and it is growing, and people are doing that. And the beautiful state of West Virginia, which has the highest opioid addiction and death rates in the country, name a statistic in healthcare. We are at, if it's a bad thing, we're at the bottom of the list. If it's, we really are have so many challenges, and they are all diet and lifestyle induced. Every single one of our state's healthcare issues are ultimately rooted in diet and lifestyle. It doesn't mean that that's the only thing now that will fix it, but if we don't change that and educate, and then use modern medicines not as a something to get codependent on and dependent on, but instead bridge us to changing the diet and lifestyle and using these other alternatives to get integrated in, that is the way we will turn that around. And it's why I came back to West Virginia. I'm really excited about the work I'm doing with trauma and addiction in the state of West Virginia. And I'm excited because it's doctors and nurses who came to me saying, will you work with us and will you help us run these programs? And, you know, now we're starting to get grant funded opportunities. And the first big groups that I'm working with, I'm teaching physicians, nurses, you know, occupational therapists, psychiatrists, people working for the VA who are dealing with the, you know, who are the social workers and the people dealing with these people that have the most debilitating diseases in our state. So I want to always be able to work with patients, but teaching the teachers and training the doctors that are in that system, that even though you and I are frustrated with that system, those people are frustrated in this system too, and they're wanting to help. And I'm so honored that they're asking for, some of them are asking for me to be a part of their teams. It's changing, and I'm so excited about that.
That's really beautiful. And I'm proud to know you, and I'm grateful that you've been able to be so open and just honest with your story, and in all the ways that you've been able to help in this state and outside of this state even. And I really appreciate you sharing your message with me. So thank you so much.
You're so welcome. I can't wait to meet you in person. And for sure, if you have any other questions, always reach out. Will say my websites and everything are changing. The other exciting thing is I just got a West Virginia 501c3 established. So we have a nonprofit organization that's just going to start growing. And when we talk about community and immunity, that's what this organization's about. It's going to be giving, hopefully in West Virginia, all of us a place to start gathering, whether we're practitioners or students, and working together to do some really cool things.
That's amazing. Well, so for anybody who wants to find you or wants to reach out to you, what is the best way to do that?
Well, the nonprofit is called The Lotus Way, and thelotusway.org is going to grow into our community organization's website. And as far as seeing me as a private practitioner, I'm there most months, at least a week or two. I travel a good bit for a lot of the other work I do and my studies and seeing my teachers, because I want to practice what I preach. But my contact information is on the organization's website, so people can reach out to me that way. I have a small practice when I'm in West Virginia. I'm a home-based doctor, or I come to people. And I do offer group classes and stuff. So we'll put that stuff out there on the website too.
Awesome. Well, thanks so much, Dr. G. I really appreciate it. It was really fabulous talking to you.
Brandy, West Virginia is lucky to have you. Thank you so much.
Thanks. You too.
Good. All right.